Welcome to a new episode of Science in Context. I'm Sabine, and this week, Dr. Monika Moir and Dr. Lucious Chabuka, as well as Christian Morgenstern, join me to speak about cholera in Malawi. Lucious, what exactly is cholera and what did your study look at?
Cholera is an acute diarrheal disease which is caused by Vibrio cholera. In our recent study, published in Emerging Infectious Diseases, we investigated the largest cholera outbreak in South Africa in recent decades by analyzing cholera samples collected during the peak of the epidemic in Malawi. Our genomic analysis revealed that the outbreak was not a continuation of previous circulating strains in the region, but rather the result of introduction of new strain. This new strain was closely related to those circulating in Pakistan around the same period, and this was a long-distance transmission likely facilitated by global or regional travel. There was also devastating floods that affected Malawi and neighboring countries during the same time. The rainy season played a key role in amplifying the outbreak during the Southern Hemisphere winter. So our findings in this study underscore the need for coordinated regional surveillance and preparedness, especially in the context of climate change.
Christian, you looked specifically at transmission in this context of climate change. What did you find?
We modeled instantaneous reproduction numbers which peaked at about 1.6. We found that flooding was positively associated with increasing reproduction numbers and that vaccination was negatively associated with reproduction numbers.
Monika, this work was part of a newly established network. Can you tell us a bit more?
Health laboratories and research groups across Africa banded together during the COVID-19 pandemic and created a strong continental genomic surveillance network. After the pandemic, we leveraged the infrastructure, skills, and partnerships that were developed and pivoted to what we believe is the current threat to global health: infectious diseases triggered by climate change. So we developed CLIMADE, the Climate Amplified Diseases and Epidemics consortium, to study and respond to climate-sensitive diseases. This study of the cholera outbreak in Malawi was made possible by collaborations between the Public Health Institute of Malawi, SERI at Stellenbosch University, and the CLIMADE Africa Network.